Give a maybe 2 or 3 minute overview of May Thurner. I know we did a separate video on DVT where I mentioned it, but wanted to give kind of a detailed explanation of May Thurner because there's a lot of conversation about it. There's also kind of a new interest in the last decade for this disease process. And so I'll give kind of an overview of what it is and what it means. And so May Thurner is something that, again, has got a lot of attention lately in the last decade or so. and basically, it has been described as a lot of different things. And so I will clear up what has been the original description of May Thurner, that is the definition of May Thurner disease, and what the areas of confusion are. And so just to kind of drill down on the anatomy. So you have an iliac vein that is bringing blood back from the left leg and pelvis, and you have one on the right as well. And the IVC, or the vein that is bringing blood back through the abdomen to the heart, is on the right-hand side of the body, of the abdomen, and the aorta is slightly left of midline coming down. And so as the right iliac artery that's heading down to the leg crosses over the left iliac vein, which is bringing blood back from the left leg, there is a right on left, artery on vein compression that can occur. And so we commonly, and I would say falsely, describe this as a compression syndrome. And so what that means is the artery squishes the vein, but that's not actually what May Thurner is. The original description described close approximation or compression, where the artery, in its constant pulsing with every heartbeat, is constantly thumping on the vein, and over a period of time that creates an injury response in the vein, which causes the wall of the vein to thicken. And so that, what we refer to as an endothelial reaction, which is more or less scar tissue forming in a concentric way around the wall of the vein, changes the property of the vein and narrows it. And so it narrows it by creating or choking it with scar tissue, but it also decreases the stretchability or distensibility of the vein, which constricts blood flow through the leg, particularly in periods of activity. And so the original May Thurner was an endothelial or an injury response to the vein that thickened the wall of the vein. Now the problem is, this was described back in the 50s, before we had CT or good ultrasound imaging. And now we have CAT scan, and everybody looks and they see patients who are laying on their back with gravity assisting them, and that artery is laying on top of the vein. And if they see a little indentation that indicates compression, then they say, well, this could be evidence of May Thurner. And there are a lot of endovascular specialists out there who will treat that sort of divot or that compression that may or not change when the patient's upright, or may just be because they were exhaling and not inhaling, or because they're not hydrated that day. And so in order to know for sure whether this is the real endothelial response with scar tissue formation and thickening of the wall of the vein, you have to do a special study in order to be able to investigate. And when we do an intravascular ultrasound, that more or less is what we're doing. And so we take an intravascular ultrasound probe, which is set up perfectly for ultrasound, because the closer it is to the area that you're examining, the higher the frequency of the ultrasound, which gives you higher resolution. And so by going inside the vein, you can get super high resolution images of the vein wall, and you can determine whether it's thickened, whether it's compressed, or both. And you get an idea whether, with the respiratory cycle, if it's stretching and collapsing like it normally would. We call that dynamic distensibility. And so an intravascular ultrasound evaluation will let you know really the property of that vein and give us an idea as to whether it's a true significant May Thurner. Now, I would argue if the patient has clot that extends up to this point, you don't really need IVUS, you don't need intravascular ultrasound, because some process has affected this enough to create a clot, and so it's less important in that situation. Much more important in the diagnostic venography when we're working up somebody with leg swelling or varicose veins, because of the pressure that's created by that napkin ring constriction in scar tissue. And so I hope that helps. All of these venograms for May Thurner should have intravascular ultrasound. That's sort of the whole reason why we're doing it. and therefore they should all have a 9 French sheath and be worked up as such. So hope that helps. Thanks.